Okay, so thank you guys so much for having us here. My name is Lucas Braga. I'm the General Manager of Honest Medical Weight Loss, and we are a in-home sustainable weight loss program. And our goal is truly to challenge the paradigm of weight loss by addressing the two biggest barriers that people have when losing weight. The first one being the yo-yo dieting, so they'll lose the weight and regain it. And the second one being the lack of either accessibility or time to really go after the services that you would need in order to achieve weight loss that is sustainable and long-term. So yes, we're challenging that paradigm, and we're addressing those two biggest questions. So where are we today? You can see even 100 years ago, people were already looking for that single solution to weight loss, whether it be an obesity soap that melts your fat away, or today we have celebrities promoting products that no one really knows if they use or not. And even Oprah's struggle with weight loss and weight gain has been made very public, and we're all very much aware of that struggle, and a lot of us have experienced that ourselves. So if these unilateral methods worked, this graph would probably not look like that. In 2025, we're expected to have at least 20% of the American population with diabetes. Also, over 25% of Americans will have hypertension and cardiovascular disease. So what is really the solution? Our proposition is that by utilizing an integrated approach that really addresses weight loss from every angle, so with the medical supervision that ensures that their medications are in check and that the program is being delivered with maximum medical efficacy, but also with the nutritional piece where the registered dietitians are educating the patients. And since our entire program is delivered in home, this multidisciplinary team goes to the patients when the patients are able to be seen. So whether it's on the weekends, weekday evenings, and then we can work with the entire family on this educational piece that's being delivered by the registered dietitians. The physical part is we have restorative fitness specialists that range from physical therapists to exercise physiologists and even a restorative yoga professional. So their goal is to create programs that are really going to address the patient's unique medical history and also history of sports and experience that they've had. So they create a program that really taps into the activities that the patients enjoy to do and they have participated in the past, and create a program that gets them back to that, back to moving, and that addresses their pain. A lot of patients that are overweight will have joint pain, hip pain, any kind of chronic pain is a big focus of our physical approach. But the biggest piece of the program is truly the behavior modification part, where our clinical psychologists go into the home and address the family as a whole. So we're talking with the spouses, with the children, and we're really creating an environment that is conducive to long-term success within their home. So the behavior therapists are addressing the family and helping them identify ways that they can provide support for this process that typically takes years. So we didn't gain weight in 3 or 4 months. It also will take a little bit longer than that to lose all of that weight and get back to a healthy BMI or healthy body fat percentage. So this integrated approach, what are some scientific, what's some scientific support for this? So we've seen there's a lot of research done on behavior modification and how to make these sustainable. This one specifically was done in terms of weight loss, how to make weight loss sustainable, utilizing either unilateral methods, meaning a nutritional approach or just exercise, versus utilizing an integrated approach that addressed both the behavior modification but also the nutrition piece, the exercise piece, and also provided medical supervision. As we can see in the beginning, and this is really where the yo-yo dieting takes place, both diets are practically equally as effective. The big change really happens after that 4 or 5 month period where the relapses start to take place and we start to kind of set back into our old habits and old routines. And with the integrated approach, what's taking place there is that through that educational process that I just talked about with the registered dietitian and the clinical psychologist, we're really able to empower the patients to create new habits and to feel a sense of ownership of the weight loss process. Thus, we're really creating autonomous behavior that then is intrinsic and also sustainable. So it is in that way that we're really trying to address the sustainability problem and offering a solution to what was previously thought of as not doable. Thank you.